A study shows that cancer now accounts for more than 1 in 5 deaths in China. The study was released Friday in the UK's leading medical journal, The Lancet. China, India, and Russia combined account for nearly all of the new cancer cases in the world, and just over half of all cancer deaths. Earlier, I spoke to Shi-Yuan Cheng, a professor at Northwestern University in Chicago. He's also president of the U.S.-China Anti-Cancer Association, and I asked him if these statistics surprised him at all.
Not really, because I'm the cancer researchers, and also our society is also doing cancers, and these numbers you can tell is sort of mixed, and one is industrializations, also control of the environment, and the other is public awareness, and also the accessibility to the cancer treatment. So these mixed make this number higher.
How does one start awareness, number one, and number two, preventing this?
Awareness, I think, have to be, at least from a government perspective, also from the educational levels, and also from media. I would say this is whole society and including government effort, because you have to tell the public and what how serious it is, how much impact the personal life, economy, and also how bad it is than before. I would say the education, public awareness, and the government involvement could be the key of the three countries.
And was this problem just as prevalent, let's say, 20 or 30 years ago, or do you think because of environmental factors, it's gotten out of hand?
I would say both. So 20, 30 years ago, and I remember lung cancer, definitely not the leading ones, but it's still in the top list. Now you have this delay impact. You know, if you're a scientist, you see cancer development, usually take 20, 30 years to show up the development. So environmental lifestyles also, especially smoking, people are unwilling to quit smoke. And people started very early to start smoking for long lifetimes. Those actually contribute to the numbers.
Do you think the Chinese government has a role in all this as far as raising awareness, perhaps through the media, to inform people about the dangers of, number one, smoking and things that they in fact can control?
I believe so. I think government, at least the agency we in our society you work with, and doctors we've been talked to and interact to, and they are willing to do it. It's just we are hoping there's more management from central government, local government, to control the smoking, and especially bystander secondhand smoking, and also start from elementary schools and in the school system to have a campaign to tell kids, especially how bad smoke could be and what's the direct cost, especially smoking has been connected with lung cancer development. So those could be done, could be government things.
All right, Dr. Shi-Yuan Cheng, we appreciate your perspective.